Compassion saves lives. That's the takeaway from a brand new book that for the first time reviews all the relevant biomedical literature, over 250 scientific research papers and more than 1,000 research abstracts. Turns out that compassion from healthcare providers isn't only proper and just, but also improves patient outcomes. Compassion also decreases costs and combats the burnout that is rampant among those who provide care. Joining me now is Dr. Anthony Mazzarelli. He's the co-president of Cooper University Healthcare in Camden, New Jersey, and co-author of Compassionomics, the revolutionary scientific evidence that caring makes a difference. Dr. Maz, the anecdotes in your book, very interesting. I'd be willing to bet that our viewers have stories of their own about how caring doctors improved their health. But it's the data that I find most compelling. Give us the evidence that compassion improves outcomes.
Thank you, Michael. I'll give you 3 quick examples from many in the book. First, let's talk about diabetes. So when they look at healthcare providers that score on a standard tool as high in compassion, their patients with diabetes have an 80% higher odds of optimal glucose control, 80% higher odds of normal cholesterol, and 41% lower odds of having complications acutely that put them in the hospital. Now, let's talk about HIV. Johns Hopkins did a study where they asked HIV patients, does your physician know you as a person? Of the patients that said yes, 33% lower odds of those patients, or higher odds of those patients actually taking their medications, and 20% higher odds of those patients having no viral load at all of HIV in their blood. Now, think about surgery, patients in surgery. In multiple experiments of infusing compassion from either a doctor or a nurse in the preoperative area, those patients required less sedative medication before going to the OR, and then after the OR, those patients needed less opioid pain medication, and they got out of the hospital quicker after their surgery.
What about cost? Because my sense is that a lot of this is time-based, and physicians don't have time. Healthcare today is what, 18% of GDP? How can being compassionate actually improve costs?
So I'll give you there's several in the book. I'll give you 2 quick examples. The first has to do with adherence to medication. So former Surgeon General C. Everett Koop said something that is famous for now, that drugs don't work in patients that don't take them. And so there's close to $300 billion a year in studies that show that preventable disease costs happen because people don't take their medications. And physicians who are rated higher in compassion have patients who are more likely to take their medications. The second example I'll give you has to do with resource use within healthcare. So physicians who practice, and all healthcare providers who practice patient-centered care, those patients have lower annual medical charges. So in one study in particular, those patients are 59% lower odds of being referred to a specialist and 84% lower diagnostic testing.
Burnout is another factor. I imagine that burnout would be impacted adversely because if I'm compassionate as a provider, it seems I'm going to get closer to my patients. I'm going to take their losses that much harder, right or wrong?
Well, wrong. So burnout is an epidemic in healthcare right now. One of the latest and hallmark studies that's come out shows that actually over 50% of providers show some sign of burnout. And traditional sort of teaching in medical school mirrors exactly what you're saying, in that this idea of don't get too close to the patients because you risk being burned out. But in reviewing things for the book, my co-author Steve Treziak and I have actually found the opposite. And we go to the neuroscience literature to look at that, and in functional MRIs of those who treat others with compassion, what they found is that it actually lights up the area of the brain that's associated with reward and positive emotion. In other words, it's the opposite. Those who actually give compassion actually benefit themselves from providing compassion to others. So burnout is
Quick final question.
Too close to patients. Yes.
Quick final question. There's an illustration
Sure.
in the book. Put it up on the screen, Catherine. A 7-year-old, I think, drew it. What's going on? Give me the bottom line as to the significance.
So that is a picture that was actually published in the Journal of the American Medical Association. You can see the pediatrician actually has his face in the computer screen. The 7-year-old who's on the table drew it because a lot of evidence shows that now physicians are spending more time looking at screens than looking patients in the eye. So you would think from our conversation that means, okay, time is the problem. But really, there's lots of data that shows you need less than a minute to actually deliver compassion and give that impression to patients. 5 studies with a median of 40 seconds is all it takes to really demonstrate compassion to patients. So really what we've found is there is science in the art of medicine, and that science is strong and it can be done, and that's what we're hoping we show when we combine stories with data in this book, that really we think compassion can be the wonder drug of the 21st century.
The book is called Compassionomics. Dr. Anthony Mazzarelli and Dr. Steve Treziak. Thank you, Maz. I appreciate it.
Thank you.
Still to come, your best and worst